Hello, everyone, and thank you for attending today's webinar, Labor and Employment and Employee Benefits Webinar Series, New Vaccine Mandates. My name is Chuck Poplstein. I'm one of the co-chairs of the Labor and Employment Practice Group at Thomson Coburn. It's my privilege to present here today with my esteemed colleagues, Viola and Colin Pajda. We are very glad you're here with us today for what is the first of 4 webinars on cutting-edge issues in labor and employment. And we hope you will make every one of those webinars, but what could be more cutting edge today than the wonderful and wacky world of vaccines? Even today, rumor has it that OSHA rules are over at the White House on vaccination guidelines and are about to come out perhaps within days, which will of course turn everything on its head. First, some housekeeping. If you have any questions during the webcast, you can submit them through the Q&A widget at the bottom of your screen. We will try to answer these during the webcast, but if a fuller answer is needed or we run out of time, it will be answered later by email. A copy of today's slide deck is available for you in the resource widget. We encourage you to download any resources or links you may find helpful. You can find additional answers to some common technical issues located in the help widget at the bottom of your screen. This webinar is CLE accredited in California and Illinois for 1.5 hours of general credit. Missouri is approved for 1.8 hours of general credit. You get extra credit apparently. New York is accredited for 1.5 hours of areas of professional practice, and Texas also is 1.5 hours of general. That is pending. This is also approved for 1.5 hours of SHRM credit, and HRCI credit is pending. Now, we do award CLE based on attendance for the entire 90 minutes. Due to some changes in jurisdictional requirements, we are no longer using automated pop-up attendance checks, and to comply with New York law, we will display secret words in 3 multiple-choice polls during the seminar. Be on the lookout for the secret words. You will be required to select today's secret word in each instance from a multiple-choice list. Please respond to these 3 polls to demonstrate your continued engagement and to earn your full CLE credit. Now, this is primarily a New York bar requirement, so for the rest of you, please don't freak out if you don't remember it, but it also ensures that and establishes that you were engaged throughout the webinar. And what would be a webinar without a disclaimer that this is a general summary of the law and practical suggestions is not a substitute for getting specific legal advice on your specific legal issues. And with that, I'll turn this over to my colleague, Viola.
Thank you, Chuck, and good morning, everyone, and welcome to what really is a wacky and constantly changing world in the area of state, local, and federal vaccine and testing mandates. Because as you all know, it's constantly on the news, the federal government and the states and various counties and cities have been very busy over the last few months enacting various laws and ordinances and issuing executive orders regarding mandatory COVID-19 vaccines and testing in the workplace. Now, this morning, we're going to talk about what the current state of the law is, but please take note, this is a constantly changing environment and may change even as we talk about it this morning. In fact, earlier this week on Monday, Texas issued an executive order, and it was no rumor that yesterday OSHA did send over some rules to the White House. So let's talk about where we are first on federal vaccine mandates, because it has a really widespread application to all types of employers. On September 9th, a little over a month ago, President Biden announced a multi-pronged plan to increase the number of Americans who are vaccinated for COVID-19. This plan is called the Path Out of the Pandemic, and it provides for multiple regulatory and executive orders to encourage or even to require vaccination in various workplace settings. Specifically, the President's plan applies to 100 or more employers with 100 or more employees, to most centers for Medicare and Medicaid services regulated workplace settings, to some federal contractors, and to all federal executive branch workers. So you might ask yourself before we dive into the details of this, what's the effective date of the plan? Well, that's a good question to which we don't have an answer yet in terms of a specific date, and which is going to vary by whether or not you're a large employer with 100 or more employees, you're in the healthcare industry, or you're a federal contractor. And of course, as you might expect, as with the effective date, the plan may leave many questions unanswered. And these questions are to be answered in emergency rules and standard issued by OSHA, the Centers for Medicare and Medicaid Services, and the Safer Federal Workforce Task Force. What we do know is that just yesterday, and we thought this would take weeks or even months, OSHA sent over the rules for large employers to the White House. So as soon as these rules are published in the Federal Register after being approved by the White House, the rules for larger employers will take effect. So let's talk about a bit about what we know so far as we sit here this morning. First, let's talk about private employers. The White House anticipates that the plan with respect to private employers will apply to over 80 million private sector employees. And the plan directed OSHA to develop an emergency temporary standard, or ETS, which apparently it's already done. And so the rules, as I said a minute ago, won't be effective until they are published in the Federal Register, which could happen very quickly. Under the ETS, private employers with 100 or more employees will be required to ensure that all of their employees are either fully vaccinated or they received a COVID-19 test on a weekly basis. Can you require employees to be fully vaccinated instead of allowing for weekly testing? Yes, except for workers who require an exemption for medical or religious reasons. And of course, you can require testing more frequently than weekly, and also can allow certain employees to work remotely. How do you measure this 100 employee requirement? Well, although we haven't seen the rules yet, OSHA has indicated that the 100 employee requirement will mean 100 employees in an enterprise, not 100 employees at any specific work site. Thus, if your company has 100 employees, the rule will apply. But again, this issue is going to be addressed in an FAQ to be issued by OSHA. What about employees who are working remotely? Do you count them? Does the mandate apply to remote workers or just those employees working on site? So far, all indications are that the ETS will not apply to those employees who are telecommuting or working from home. But if these employees come into the office at any point, the ETS will likely apply. So telecommuters must be vaccinated if they come into the work site. And of course, the bigger issue is, how do you verify someone's vaccine status? Well, we don't have an answer to that question yet, and Colin will talk about the nuts and bolts of the new mandate later on. And of course, there might be a potential conflict between the vaccine mandate and certain state laws, such as Montana and now apparently Texas, where employees are going to be prohibited from taking any adverse action based on an employee's vaccination status. So I think at this point, even though the rules are not published and not finally established, you should start considering how you're going to determine vaccination status in a manner that not only complies with the federal mandate, but with state laws and, of course, with all privacy laws, including, of course, HIPAA. And if the ETS requires disclosure of test results, as we expect it will do, you can ask for test results for those employees who are subject to weekly testing. But again, please make sure to keep the results confidential. Now, once the OSHA standard is issued, those covered employers likely will be required to offer paid time off for employees to receive the vaccine, as well as to recover from any post-vaccine side effects. If you fail to comply with these rules, you may be subject to a $14,000 fine per violation. I know that's a really big fine, and it's going to add up very quickly. And there are some states, such as California, from where I'm speaking, in where a vaccine or testing is already required. Employees are required to pay not only for the cost of testing, but for the time spent by the employee to get the vaccine or test, and in addition, any travel expenses, such as mileage or bus or car fare, associated with getting the vaccine or the test. Now you might ask yourself, I'm a unionized company. Do the rules apply to my union employees? Do I need approval from the union? Well, yes, the rules apply to unionized companies. And in most instances, you'll also need approval from the union. Because let's face it, the union acts as a representative of the employees, and its purpose is to give employees the power to bargain with employers on certain mandatory subjects of bargaining. And mandatory subjects of bargaining would include policies that directly impact the terms and conditions of employment. It's most likely that the vaccine mandate will be considered a mandatory subject of bargaining. And as a result, unless a company can point to some language in the CBA already providing it with a right to implement the vaccine mandate or a very clear past practice, the company is likely going to need to bargain with the union over that decision. And even if the CBA does have language that appears to grant the employer the ability to implement a vaccine mandate, even without consulting with the union, employers likely will need to bargain with the union over the details of implementing the mandate. For example, there will be details such as handling employees who have side effects from the vaccine, handling religious and medical examinations to the policy, perhaps moving employees to other positions because of social distancing requirements for those who are not vaccinated, and other nuts and bolts type issues that will need to be bargained. Now, let's recognize the fact that many employers deal with independent contractors as part of their workforce and with volunteers. So, does the mandate apply to independent contractors and volunteers? Well, if you haven't signed a contract yet with an independent contractor, you can require a full vaccination as a condition of the engagement. If you have an existing contract, however, you probably can't impose such a requirement without amending the contract, but there's one thing you can do. You can prohibit anyone, be they independent contractors, a vendor, or any other visitor, from entering your premises unless they're fully vaccinated. Now, what about volunteers, if you have volunteers working at your work site? Well, as is the case with independent contractors, volunteers are not employees and are not subject to the President's new plan. But as is the case with independent contractors, you may still require that they be fully vaccinated. Just make sure they really are volunteers and they're not employees. Because if they are employees, you're going to have to consider accommodations for those with medical or religious exemptions. And of course, this subject of independent contractors and volunteers also brings up the whole subject in California and in some other states which have followed California's lead, actually it was Massachusetts' lead, on AB5, the so-called ABC test for determining who is and who is not an employee. Make sure your independent contractors and volunteers really are not employees. Okay, and I've already seen some questions on this, so this is an appropriate time, I think, to delve into what about the effect of the President's plan and the federal mandate on state laws that already prohibit vaccine mandates? What is an employer supposed to do? And of course, as with just about everything nowadays, there already is litigation on this subject, but we just don't have an answer, a definite answer that is, at this point. The federal rules and the OSHA standards likely will preempt any state or local laws prohibiting employers from implementing vaccine mandates, such as we'll talk about in a few minutes, the Texas order issued on Monday. But again, we don't know when OSHA is going to issue the new rules, although it likely will happen very quickly. And it's also unclear as to whether the new rule will apply to workers who work remotely on an exclusive basis, as this appears to have happened during the pandemic. Okay, we've come to our first secret word. Today's first secret word is blue. So please select the correct secret word from the drop-down selections on the slide, so you will get full credit if you're in New York. Again, today's first secret word is blue. And I'll just allow about 10 seconds or so for people who need to complete this. Okay, let's move on. And it will be a second secret word soon. All right, how does the Path Out of the Pandemic plan apply to healthcare workers? Well, under the plan, the Centers for Medicare and Medicaid Services will begin requiring vaccination for employees in most healthcare settings, including hospitals, dialysis facilities, and ambulatory surgical settings, and home health agencies as a condition for continued federal funding. Right now, the condition for federal funding for vaccine mandates only applies to nursing homes. So it's estimated that this new requirement is likely going to impact approximately 50,000 providers and 17 million healthcare workers. So you can see the effect that this plan will have on getting America vaccinated. For federal contractors, it's a little different. The rules are a little different than they are for healthcare providers and large employers, although, of course, the large employer and federal contractor rules may apply across the board to one employer who might be involved in all three areas: large employer, healthcare, and federal contractor. So rather than specifically mandating vaccinations for federal contractors, the order requires executive agencies and departments to include a clause in their contracts and, quote, contract-like instruments, unquote, stating that the contractor and any and all subcontractors will comply with all guidance from the Safer Federal Workforce Task Force. The term contractor itself is also going to be applied very broadly to those who hold contracts and contract-like instruments, such as leases. Further, with respect to federal contractors and subcontractors, a fully vaccinated mandate applies to, quote, any workplace locations in which an individual is working on or in connection with a federal government contract or contract-like instrument, unquote. And as we sit here for today, the threshold for application is for federal contracts that are worth $250,000 or more, although that may be lowered. We just don't know at this point. Now, importantly, this mandate is very broad. It applies to part and full-time employees of federal prime contractors and subcontractors at any tier in the supply chain who are either working directly on or in connection with a contract. And again, this is very broad. It includes indirect support people such as human resources, billing, and legal review. And it also includes employees who perform custodial work, security, or perform maintenance services at facilities that perform not only government work, but perform both commercial and government work. The order applies to, quote, any workplace locations in which an individual is working on or in connection with a contract. So it doesn't matter whether or not the employee is working at a federal workplace or at locations controlled by the contractor. And the order applies to outdoor work sites, and all employees at those locations, even if their work is not connected to a federal contract, unless they're fully separated from those working on a contract and will never be able to interact with the employees working on a federal contract. And for federal contractors, the mandate applies to remote workers as well. Under the Federal Contractors Task Force task rules, workers who have been previously infected with COVID-19 are included in the mandate, as well as those who work from home permanently. Masks and physical distancing will be required for both employees and visitors in line with CDC guidelines. And the federal contractor rule is going to override any state or local law or ordinance that would prohibit compliance, although even more protective local standards, such as we have in California, will continue to apply. Now, again, as with everything, there are different rules for federal contractors, and employees of federal contractors and subcontractors will be required to be fully vaccinated against COVID-19 by December 8th, or the first day of performance of a new contract, even if they're not working directly on a government contract. However, if a contracting employee is working on-site at a federal facility, this vaccination date is moved up to November 22nd. Now, the federal contractor mandate doesn't apply to all contracts or contract-like instruments. For example, the contractor rules do not apply to non-executive department agencies or to the GAO. It does not apply to contracts with Indian tribes, to grants, or to contracts below the $250,000 threshold. And of course, it doesn't apply to contracts performed outside of the United States. There's also, of course, separate rules for executive branch employees. And these are about, it's estimated, some 4 million employees, including civilian contractors. Importantly, for these executive branch employees and civilian contractors who work directly for the executive branch agencies, there is no option for workers to be tested instead of receiving a vaccine. So in other words, for executive branch employees, a vaccine is mandatory. There's a 75-day ramp-up period to allow the employees to become fully vaccinated. But again, the executive branch employee rules only apply to executive branch employees. They do not apply to congressional employees or to federal court staff, although certain federal courts, including the Central District of California and Los Angeles, have already implemented their own vaccine mandate. And with respect to executive branch employees, and we'll see if this stands scrutiny by the courts, the White House has indicated that medical and religious exemptions will be granted only on a restricted basis. As we'll see in a minute or two, that's been tried in New York and has been met with resistance by the courts. And before I forget, and this is important given that we're in football season and the MLB playoffs, the president's plan also requires that large entertainment venues, such as sports arenas and large concert venues, screen patrons for proof of vaccination or negative tests upon entry. And obviously, this is going to impose logistical problems at these venues, especially, I think there were 53,000 people at the Dodgers game yesterday. You're going to have, if you're operating an entertainment venue, enough people to do the screening, to check vaccine cards or phones or test results to let people in. So this is going to obviously present logistical hurdles and require more employees to implement this mandate. What about schools? What does the president's plan do for schools? Well, for schools, the plan only applies to federally run schools, and the requirement is that all staff be fully vaccinated. But the plan also calls on all states to mandate vaccination for their own school employees, and we see in California that Governor Newsom has already done that. Now, moving on to some of the states, since most, if not the majority, of the people in the audience are from Missouri, neither the state of Missouri nor any local governments have enacted any mandates requiring vaccines or testing. In fact, the state of Missouri is one of the states challenging the president's plan, so stay tuned. What about Illinois? Well, on August 26th, Governor Pritzker issued Executive Order 2021-20, effective on that date, August 26th, requiring that all individuals in Illinois who are at least 2 years old and who are medically able must wear face coverings indoors and in other specified settings. But in addition, on the mandate front, the order requires all healthcare workers and state employees in congregate settings, which basically are prisons and nursing homes, to be vaccinated. But in addition, school personnel, higher educational personnel, and higher education students must be vaccinated or be tested on an at least weekly basis. The governor has given more time for these mandates to be extended. For healthcare workers, school personnel, and higher educational personnel and students, the initial dose must now have been received by September 19th. So there's not much time there for people to get their second dose. And for employees at state congregated facilities, as well as contractors and vendors at those facilities, the deadline for a first or single dose is tomorrow, October 14th, and the second dose deadline is November 18th. Now, importantly for Illinois employers, it does not appear that at this point you have to pay for the testing. It's not considered an expensive employment under Illinois law currently. The theory underlying this is that the testing benefits employees, not employers. So the Illinois law requiring payment of employer expenses does not apply. And contrast that with the next state we'll talk about, which is California, where you must pay for the testing. So what's going on in California? Well, back on August 5th, the California Department of Public Health issued an order requiring all healthcare workers to be fully vaccinated unless the worker can provide an acceptable written medical or religious exemption. And as defined in the order by the Department of Public Health, a worker includes not only paid but unpaid individuals who work in indoor settings where care is provided to patients or patients have access for any reason. And this would include all workers who have potential for direct or indirect exposure to patients, including not just nurses and technicians, but students, contract staff not employed by the facility directly, security, building management, and even extending to administrative and billing personnel at healthcare facilities. And if a worker qualifies for a medical or religious exemption, they still must be tested for COVID-19 twice weekly in an acute healthcare setting or once weekly in other healthcare settings. And if you're exempt in a healthcare setting in California, you must wear a surgical wet mask or a higher level respirator, such as an N95 respirator, at all times while in the facility. And consistent with privacy laws and regulations, the facility must maintain records of each vaccination or exemption status and maintain all test results. With respect to schools, you may have already heard that Governor Newsom announced that California students aged 12 and above must be fully vaccinated, and they're going to extend this mandate as soon as the vaccines receive FDA approval for lower age groups. And finally, in California, a week ago, on October 6th, the LA City Council approved a new ordinance requiring proof of vaccine against COVID-19 to enter indoor restaurants, shopping malls, movie theaters, hair and nail salons, and many other indoor venues. And indeed, I know there's some people on the line from Hawaii. Hawaii has a very similar law. New York. What is going on in the Empire State? Well, there's a lot of court cases going on in New York right now, but on September 27th, all healthcare workers in New York were to have received at least one dose of the vaccine. That includes staff at hospitals, long-term care facilities, nursing home, etc. And in connection with the announcement, the New York State Department of Public Health is going to issue orders requiring all hospital, long-term care facilities and nursing homes to develop and implement a plan mandating employee vaccinations. Now, New York announced that only limited exceptions are going to be made for those with religious or medical examinations for not being vaccinated. But on September 14th, a New York federal court issued an order blocking, temporarily at least, New York State from enforcing the mandate, quote, to the extent it categorically requires healthcare employers to deny or revoke religious exemptions from COVID vaccine mandates. New York City also issued a mandate requiring patrons and workers of indoor dining facilities, indoor fitness, and indoor entertainment venues to be vaccinated. And of course, the U.S. Supreme Court has gotten involved in this. On October 1st, the Supreme Court denied a request for an emergency injunction by a group of New York City school teachers claiming that the New York City vaccine mandate for public school employees violated their constitutional rights. So stay tuned and we'll see what goes on in New York and in the courts. Last but not least, of course, is the great state of Texas. Just 2 days ago, on Monday, October 11th, Governor Abbott issued an executive order banning any entity in Texas, including private businesses, from requiring vaccinations for employers or customers. He also called on the Texas legislature to pass a law to the same effect. Now, of course, this conflicts directly with the Path to the Pandemic Plan and the regulations on large employers, federal contractors, and healthcare facilities just ordered by the president. So we're just going to have to wait and see for the dust to settle to see what will happen in the conflict between federal and state orders on this issue, not only in Texas, but across the country. At this point, we're going to move on to the second secret word, which is particularly appropriate given the time. Today's second secret word is lunch. Please select the correct secret word from the drop-down selections below. Again, today's secret word is lunch, and we'll give everyone about 15 seconds or so to enter their selection before we move on to the next speaker. Okay, again, I see we have a majority of people have answered the question. If you haven't done so, if you didn't hear me for any reason, the second secret word is lunch. Please enter your selection, and I'm now going to turn it over to Chuck Poplstein. Chuck, welcome back.
Thank you, John. Even if you are not technically someone who you believe is, as an employer, is subject to the executive order here for federal contractors, it certainly has implications for you because I expect it will foreshadow the OSHA rules. And both of those, both the OSHA rules coming up and the executive order, are just the latest examples of government efforts to really achieve objectives by, as to vaccinations, by really trying to shoehorn it into existing laws. So I think you can assume that the contracting officers here have considerable discretion, and that includes for people below, for contracts below $250,000, that they can still enforce the mandates, and that they're going to probably push this as far as they can and as aggressively as they can until told not to. That's certainly what they did, what the government did with regard to the moratorium when the Supreme Court asked them to make changes, and they basically kept extending the moratorium without going back to Congress. So I think you can assume the questions are, even if we don't know for sure, assume the government's going to take the position that they're right and whatever will achieve their objective here, and they'll do that until the courts tell them not to. Now, I'd like to talk about the other wacky world here as part of it, which is exemptions. And this is kind of a trick question when I talk about claimed exemptions we're going to talk about this morning, because one of those is not really an exemption, but people claim it is an exemption. And the one here in particular we're talking about is natural immunity. That's certainly not specifically recognized by the executive order. And by natural immunity, what I'm saying is what we heard early on in the days of COVID, herd immunity, or if you basically had contracted COVID, you therefore basically acquired immunity from the illness going forward, and therefore people felt free that they could go out and do whatever they wanted to because they had already gotten the illness. Nevertheless, the executive order doesn't recognize natural immunity as an exemption from the executive order. The CDC, in fact, recommends that people get the vaccine, citing a study that came out in August that says that people who have had COVID are more than 2 times as likely to be reinfected as vaccinated purposes. And the science is still unclear how long any natural immunity will last. So no one really knows at this point the extent of natural immunity and when someone can really be safe and be out in public without being at risk to contract the disease if they have not been vaccinated. But that hasn't stopped people from saying that my natural immunity, according to what the science I want to rely upon, is stronger than what the CDC says. And people have actually challenged this into the courts. There's only been limited case law to date about natural immunity claims, and they've all been in the area of either Michigan State University or University of California, where they had vaccine mandates imposed on their employees. And in each of those cases, that was challenged premise on a natural immunity claim. And in each of those instances to date, the courts have rejected those claims and have essentially said this is a rational basis, and as long as there's a reasonable basis for the state to rely upon science, which is available, in this case, the CDC recommendations and state health authority recommendations, that's reasonable and rational, and they're not going to question that. Now, those both involve constitutional rights, but I expect we will see that essentially the courts will most likely continue to say we're going to rely on science and what the state and federal public health agencies are doing, what the CDC is doing, and if you as an employer are relying on that, I think you can safely decide how to deal with the natural immunity claims accordingly. Because I think most courts recognize they're not doctors. Which brings me to another point. Going forward on this for all of us, it's certainly in deciding how to deal with accommodation requests and what's appropriate. We are all not doctors. To the extent you can develop a contact with someone who is an expert in contagious diseases, an epidemiologist, I think the better off you are to rely on that type of medical advice to inform your decisions. Now, going to what is a real exemption recognized by the executive order and as well as generally by the EEOC is the standard medical exemption, which under the ADA and similar state laws will require that a covered employee provide a reasonable accommodation for a disability. Of course, it has to be a real protected disability, a physical or mental impairment that substantially limits one or more major life activities. And in this instance, of course, the issue is whether the person is medically unable to be vaccinated because of a disability. And that includes, by the way, whether a claim that they might have some type of social anxiety disorder that prevents them from taking a vaccine. And that is really kind of a landmine here. You run into the same issue when it comes to a mask. Now, essentially, you have a duty to provide a reasonable accommodation that would not result in an undue hardship. And that generally under the ADA, which is a higher burden, means does that require or result in significant difficulty or expense for the employer? Along those same lines, is there a direct threat? And that is generally construed as a significant risk of substantial harm to health or safety of the individual or others that cannot be eliminated by a reasonable accommodation. In doing that, in terms of the scope of the undue hardship, it's one of those situations, as far as the EEOC is concerned, that the employer's overall budget and resources and the costs of the accommodation are what's factored in there. Therefore, what may be okay for the local restaurant as an undue hardship may be a much higher burden for Southwest Airlines or Boeing. Again, you have to be in a situation where you consider the availability of alternate arrangements or least restrictive means. By the way, exposure of family members is not considered to be a medical accommodation for purposes of the ADA. By that I mean, if someone says, I don't want to, I'm medically not able to take the vaccine, I think that because I'm worried about coming in and a risk of COVID, that I can infect a family member, that's not generally deemed to be sufficient as a type of a medical accommodation here. Is telework a possible accommodation? Not if it prevents the performance of an essential job function. Now, nonetheless, again, as a reminder, I'm sure you're all familiar with this, but clearly it certainly is a reminder that reasonable accommodation requires an individualized, interactive process. You can't just decide, we're going to draw a bright line, and everybody who requests a medical accommodation is getting treated the same way. That may very much depend upon the particular job involved, the particular circumstances, the particular request by the individual. So you do need to engage in sit down or confer with the individual and see how that will work out. And by the way, don't forget encouraging them to basically talk to their doctors and make sure, or you talk to their doctors, because we've had situations for where somebody went to the doctor after they claimed that I don't think I can take the vaccine because I'm at risk, and the doctor told them to get the vaccine. So clearly, can you obtain additional information as necessary? Yes. Can you certainly make sure you get documentation to support the request for the medical accommodation? Yes, as opposed to just relying on somebody's concerns or existing medical condition as they understand it. What types of accommodations obviously are available? Testing, masking, telework, other types of accommodations, which are just basically whatever is within the imagination of the employee and the employer that's a practical solution to problems. Again, you don't always have to accept the employee's requested accommodation. Certainly there may be situations where the accommodation would prevent the performance of an essential function, and in those situations, then certainly you can reject that proposed accommodation. Socially distanced situations, distancing, isolation, masking, temporary leave, all types of potential accommodations. And I think basically, again, you just have to deal with it on a case-by-case basis. I think over time, general standards will develop which allow you to be fairly consistent for similar, well, certainly for the same types of jobs. The religious exemptions, again, are an issue here that comes up a lot, And I'm sure all of us have heard, and if you haven't, there are certainly situations out there where people are either selling an extended letter which discusses why someone would have a sincerely held religious belief and why they believe that a person does not have to be vaccinated. There's some people out there who are selling those letters on the internet as well. And so we certainly are seeing a rash of religious accommodation exemptions, much more than we would otherwise receive in the ordinary course of business pre-pandemic. Again, this really arises under the employment discrimination laws, in particular, the duty to accommodate the exercise of a person's religious beliefs. Now, the duty here is, to be clear, is much more limited than under the Americans with Disabilities Act or equivalent state law. It's not the same standard. There's not the significant burden and the like which is set out in the ADA. Basically, you have to reasonably accommodate the exercise of someone's sincere religious beliefs unless it would result in more than a de minimis cost or burden. Again, unless it would result in more than a de minimis cost or burden. So if someone could just swap shit, the standard one historically has always been people don't want to work on a Friday night because of a religious belief. And if someone could swap a shift, there's no real cost to the employer, so this is not a significant issue. That is a de minimis cost or burden. That, in part, according to the EEOC, is tied to the wealth of the employer, just as it is in the case of the ADA. But it can also be tied to disruption in operations. It can be tied to situations that compromise workplace safety, decrease safety, or puts an undue burden on someone else's rights or job obligations. You still have to explore alternatives. You still have to offer a reasonable accommodation. But remember, you do not have to accept the employee's preferred method of accommodation. It just has to be a reasonable accommodation, and you can suggest your own reasonable accommodation and not have to accept somebody else's proposed reasonable accommodation. Likewise, it must be a sincere religious belief. That is a low threshold, and it does not have to correspond to a core religious belief or practice. That certainly helps, of course, but each person is generally in a position to answer their own sincere interpretation. Is a limited inquiry acceptable? Yes, but certainly I don't think you want to go out there and ask people that if they're refusing the vaccine because of the vaccine's based on fetal stem cells, does that mean that they also are going to commit not to take Advil or not to take Tums, antacids, because those also have some derivation from stem cells? You don't want to get into those kinds of details. The courts generally tend to do the sincere religious belief with a light touch, although, as I will talk about a little bit later, when it comes to the Religious Freedom and Restoration Act, the Supreme Court indicated we think federal courts can figure out who has a sincere religious belief and what is not a sincere religious belief. Now, along those same lines, that also requires, in terms of a religious belief, that it must be something that is tied to moral or ethical standards dealing with life or death or purpose in life, not just a social philosophy. For example, I don't think someone could say, because I'm a communist, I don't believe I should be required to take the vaccine. So remember, there does have to be some connection with religious belief. Again, I think that in these circumstances, can you require proof? Yes. Should you require proof? And should you require some type of certification for the religious belief to test the sincerity and maybe do a very limited but light touch there? Yes, because if it turns out later on that somebody is out there on Facebook saying how they put one over on their employer by pretending they had a religious need not to take the vaccine, you can address it. I also want to mention a little bit here about the Religious Freedom of Restoration Act, because it is possible this will be one of the key challenges to the religious exemption from the vaccination requirements that many of the states are talking about, that John was talking about in the case of New York. The RFRA here, or the Religious Freedom Restoration Act, has been a big focus of the Supreme Court. It certainly was when it came down to the shutdown orders, for example, and how that impacted religious institutions. I just kind of mention it here. It's not essential for your day-to-day activities, except to recognize that that may come into play, and that generally the court talks about you need a compelling governmental interest to restrict the exercise of certain religious beliefs that are sincerely held. It has to be the least restrictive means, and that the Supreme Court said very clearly in the Hobby Lobby case, you can't base your judgment on telling an individual that their beliefs are flawed and yours are correct. As long as it's sincerely held, the courts are generally going to give it a fair amount of leeway. So what types of exemptions and accommodations can you have here? Again, we mentioned in terms of how you accommodate, engage in the interactive process, require proof and certification like we've talked about, determine what accommodation is reasonable within that particular job. The testing's an interesting issue, because if it turns out the employer is required to pay for the test, that might be considered more than a de minimis cost, because that's for the benefit of the employee. Masking, social distancing, telework, health insurance charges, maybe increased wellness points for those who are vaccinated. All those are kind of things which you can consider in these instances. Telework, of course, may be a situation where there's a lot of people who would like to claim the religious exemption because they would prefer telework. Again, there is a duty to accommodate. Is it going to impact the person's job? As you have to decide up front here, rather than on a temporary basis, whether or not the telework in any way is something that is really, as a practical matter, doable, and something you would generally allow in pre-pandemic time. And just because you've been allowing it during the pandemic, the EEOC has generally said a temporary accommodation on telework because of the pandemic does not per se create an exception or a precedent for allowing someone to telework in the future. They may require that, they may look at that a little more closely for ADA purposes, but certainly not for religious accommodation. And now I'd like to turn this over to our next secret word. The secret word for the day is dog. The secret word is dog. I knew someone whose nickname in grade school was Dog, and in college. Okay, so now I will turn it over to my colleague, Colin Pajda, for talking about the nuts and bolts of vaccinations and testing. Colin?
Thanks, Chuck. So now I'm going to walk through some of the practical considerations for the vaccine mandates and for COVID-19 testing. And this is both in the context of the federal mandates, which John walked us through, and in the context of employer-enacted mandates and testing. Now, the first thing any employer facing a federal vaccination mandate or considering enacting their own mandate should do is to survey their workforce for current vaccination rates. A well-constructed survey can tell you how much effort will go into achieving full vaccination and how much pushback you're likely to receive from your unvaccinated employees. But there are also some pitfalls you should be careful to avoid. So first, as John mentioned, you need to be aware of your state's laws regarding vaccination inquiries. Some states like Montana are putting a lot of restrictions on what you can require in terms of vaccines and what you can ask about vaccines. Similar laws have been introduced in at least a dozen other states, and this is an area that is changing rapidly and will potentially lead to a big conflict with the OSHA ETS. So before you start your survey, it's always best to consult with employment counsel to make sure you're aware of any extra state-level restrictions. On the federal side, the EEOC has released guidance stating that asking an employee whether they have received a COVID-19 vaccine is not a disability-related inquiry under the ADA, and neither is asking employees if they intend to become fully vaccinated in the future. So these are the two questions you can ask an employee. Are you fully vaccinated? Do you plan on becoming fully vaccinated? However, how you ask those questions is very important, and this is one of the big hidden pitfalls I mentioned earlier. Asking if an employee is vaccinated or plans to be vaccinated is not a disability-related inquiry, but it can become one if the employer asks why the employee does not intend to get vaccinated. If an employer asks why, the employee's response might be, I don't believe in vaccines, or something like Nicki Minaj's cousin's friend allegedly had a bad reaction to a vaccine, or it might be because of an ADA qualifying disability. So, for example, if you ask an employee why they said they won't get a vaccine, and they respond, I have a history of severe anaphylactic reactions to components of the COVID-19 vaccine, which is a common issue that we've been hearing. Your simple why question might have just become a disability-related inquiry because you've elicited that additional medical information, and maybe even unintentionally. So when you're thinking about how you're going to conduct your survey, you need to make sure you're not giving employees the opportunity to respond with potentially protected medical information. I highly recommend using an electronic survey with buttons for yes and no, and which does not give the employee space to provide any additional information. If you're going to use paper or an email survey, maybe because that's the best way for you to gather responses from your workforce, you should have a clear statement that says something like, only check yes or no in response to the following questions. Please don't provide any additional information. Remember, at this point in the process, you're just trying to find out how many of your employees are vaccinated and how many are going to resist vaccination. As Chuck discussed, the reasons for not being vaccinated, whether they're religious or medical, those come up later after a mandate is in place, when the employee is seeking an accommodation. Finally, what do you do with the information once you have it? And we're going to discuss this in a lot more detail in the next section, but as a general rule, all vaccination information should be treated as confidential medical information. And in simplest terms, this means it should be kept separate from an employee's regular personnel file, and access to the information should be restricted on a need-to-know basis. So here's a quick example of our two questions. Are you fully vaccinated against COVID-19? Do you intend to become fully vaccinated? And a few notes on this. As a rule of thumb, always define the term fully vaccinated whenever you use it. The federal mandates will likely supply their own definitions, which you can follow. Or you can say something like, as used here, fully vaccinated means that you've received 2 doses of the Moderna or Pfizer vaccine and that 2 weeks have passed since receiving your second dose. Or, you've received 1 dose of the Johnson & Johnson vaccine and 2 weeks has passed since that dose. You just want to make sure that you're clear that fully vaccinated doesn't mean the employee has received one dose of a 2-dose vaccine or even has just received the second dose. You need to build in those waiting periods for an employee to be fully vaccinated. Okay, so let's jump into vaccinations. We're generally seeing 3 kinds of vaccine programs right now. We have the federal mandates, the employer mandates, and incentive programs. A lot of information on the following slides will apply to all 3 of the programs, but there are some notable differences. For example, if you're in a state that prohibits vaccine mandates, then you can't have an employer-enacted mandate, but you would still likely have to comply with any applicable federal mandates. And in most states, you could still incentivize employees for receiving the vaccine. Okay, so let's talk about some logistics for vaccinations. The first thing you're going to want to think about when planning a vaccination program is timing. So remember, for an unvaccinated employee to become fully vaccinated, there is some waiting time involved. For the J&J vaccine, it takes 2 weeks for employees to become fully vaccinated, so that's 2 weeks after they've received their first shot. For Moderna and Pfizer, it's 2 weeks after the second shot, but you also have to take into account that the 2 Pfizer shots have to be 3 weeks apart, and the 2 Moderna shots have to be 4 weeks apart. So with Moderna, you're looking at least 6 weeks after they've had their first shot for an employee to become fully vaccinated. Now, if you're a federal contractor whose employees need to be fully vaccinated by December 8th, as John mentioned, that means any employees receiving the Moderna vaccine need to have their first shot by October 27th. Similarly, if you're implementing your own employer mandate, you need to think about what date your employees need to get vaccinated by and make sure that they have enough time to comply with your policy. The next issue is location. Where your employees get vaccinated is going to depend largely on vaccine availability in your area. In places where vaccines are easy to come by, logistically it may make sense to have employees find their own vaccines. In areas with fewer options, some employers have begun co-hosting vaccination events with local health departments to make sure that their employees have access to vaccines. This also raises leave issues. As John noted, under the ETS, employers will be required to offer paid time off for employees to receive the vaccine and to recover from any post-vaccination adverse effects. The DOL has clarified that the ETS will allow employers to require employees to use any accrued PTO they might have available. And employers will also want to consider if they're mandating their own vaccine policy outside of the federal mandates, whether they want to allow employees to use PTO to get vaccinated, which we've seen has been a way to significantly increase vaccination rates. Next is a big issue, proof. What kind of proof can you require from employees to show that they're fully vaccinated? How should you store the information? Who should have access to the information? To start off, as John mentioned, this issue has been complicated by some recent state laws, for example, in Montana again, which prohibit employers from requesting vaccination information from employees. In those states, we expect that the OSHA ETS will preempt the prohibitions, but until the final standard is released and the challenges begin and are resolved, we won't know for sure. Outside of those states, which is most states, you can require employees to provide copies or scans of their official vaccination cards. And this is generally the preferred source of proof for employer-mandated vaccinations and will likely be required by the ETS as well. But documentation from, the vaccinated health authority in lieu of the card may also be allowed. For employers who aren't covered by the ETS or another federal mandate, you could require a different kind of verification, but in the very least, it should include what kind of vaccine the employee received, the dates each dose was received, and which entity distributed the vaccine so that you can verify if you need to. Now, generally when you're requesting proof of vaccination, that means proof that the employee is fully vaccinated. As we discussed earlier, fully vaccinated means receiving the full dosage of the vaccine, waiting the required 2 weeks after the last dose. We have seen some employers implement vaccine mandates in a stepped format. So, you need your first shot by this date, you need your second shot by this date. And in those cases, you might request a scan of an incomplete vaccination card or just an employee attestation that they've received their first dose. It's also worth mentioning that the definition of fully vaccinated might change over the next few months as the question of booster shots is settled. Okay, so you have your proof. Now, what do you do with it? As I mentioned earlier, vaccination records should be treated the same as confidential employee medical records. This means that it should be kept in a file apart from the employee's general personnel file, and access must be restricted. We've been finding that some employers want to keep all of the scans electronically, in a secured folder or program, which is a great option. Others want copies of the cards to keep in the employee's medical file. Right now, either of those options work as long as they have the appropriate security, because remember, access must be restricted. When the ETS is released, it may include other record-keeping requirements, for example, how long you need to keep the records, how you need to be able to report the records to OSHA. So stay tuned for our updates on that issue. Finally, is the issue of access. I've said before that access to vaccination information should be restricted to those individuals with a business need to know. That might include HR representatives, whose job it is to collect vaccination information and ensure compliance with the company's vaccination policy. It might include members of management who need the information, for reporting purposes, maybe to OSHA or to evaluate the progress or success of a vaccination program. In some cases, it might also include individual managers or supervisors. For example, if your workplace has a policy that says fully vaccinated employees do not have to wear face coverings in certain areas of your facility, managers who are tasked with enforcing the company's masking policy likely have a need to know who is vaccinated so they know who doesn't have to wear a mask in those places. So now we're going to move on to talking about enforcement. So you have an employee who does not have a medical or a religious exemption and who is refusing to comply with a mandate, either federal or employer enacted, and the deadline for getting vaccinated has passed. So what do you do now? If you're covered by the ETS, you could choose to allow all employees who aren't vaccinated to be tested for COVID weekly. And we'll talk about testing a lot more in the next section. But if you aren't allowing the testing opt-out, or if you're covered by, say, the federal contractor mandate, which does not allow testing in lieu of vaccination, your next step is discipline. And you have some options with that. A common first step is unpaid administrative leave. The general idea is that you're giving the employee a specified amount of time to get into compliance with the mandate before you move to termination. You'll want to keep in mind the timing we discussed earlier because, depending on the vaccine, it could take that employee 6 weeks to become fully vaccinated. So some employers have used this initial unpaid leave as a chance for the employee to receive, the first dose of a shot and allow them to return to the workplace as long as they agree that they're going to submit to weekly COVID testing and that they'll receive the final dose of the vaccine at the designated interval. However, keep in mind that this might not be possible if you're a federal contractor, as you're required to exclude unvaccinated employees entirely from the workplace after the vaccination deadline. So in those cases, you can't have them come back before they're fully vaccinated, even if you're going to do testing. Finally, there's termination. This is either a final step after administrative leave or as the initial discipline for failing to meet a company's vaccination deadline. In any case, your vaccination policy and communications about the policy should state clearly that employees who do not comply with the mandate may be terminated. So you want to make sure that employees realize that this is how you're going to enforce the policy and you're taking it very seriously. Now, there are two caveats to what we've discussed about enforcement on this slide. The first is, and John mentioned this earlier, if you have a unionized workforce, you're going to need to bargain with the union over discipline for failing to comply with a vaccine mandate. So, is it a 2-week administrative leave? Can you go straight to termination? Do they have to use up, PTO time before they're put on an unpaid leave? The second caveat is that in some states, I'm looking at Montana again, prohibit you from terminating or even disciplining an employee for not being vaccinated. In those states, you should talk to employment counsel who can advise you on your obligations under any of the federal mandates and how those mandates might affect your compliance with more restrictive state laws. Okay, now we're going to move on to testing. So the OSHA ETS requires employers to have all employees who are not fully vaccinated submit to testing at least once per week. Employers can also mandate testing for employees either as a standalone program or as an alternative or exemption to the employer's vaccine mandates. One of the first questions we usually get when an employer is considering requiring testing for its employees is, which test can we use? Currently, there are 2 kinds of tests that have received emergency use authorizations from the FDA, and the EEOC has released guidance saying employers can use either of them for employee testing. The first is the PCR test. The PCR test is considered kind of the gold standard of COVID tests because of its sensitivity and accuracy. This test detects the genetic material of the virus at the time of the test and is extremely accurate at detecting whether you have or recently had COVID. In terms of process, the PCR test usually begins with the old nose swab. And this can be either the deep swab, affectionately referred to now as the brain tickler, or it can be the newer, shallower, and much preferred nasal swab, which just goes at the base of the nose. And then once you have the sample, that sample is sent to a laboratory for testing. Now, the biggest drawback to the PCR, it's the most accurate, but it takes on average 1 to 3 days for the lab to send the test results back. The alternative is the antigen test, which is what we generally refer to as the rapid test. Unlike the PCR, antigen tests usually take only 15 to 30 minutes for results. Another huge benefit of the antigen test is that it can be taken at home or in the workplace and can be significantly cheaper than the PCR test. However, it also has its drawbacks. It's generally not considered to be as accurate as the PCR and becomes even less accurate a few days after infection. And this means that false negatives can happen even while a person is still contagious if they're towards the end of the infection period. In contrast, the PCR is still able to detect the virus several weeks after an initial infection. I do want to mention here that generally in the U.S. we are experiencing a shortage in testing kits at the moment. The early success of the vaccines, before the Delta variant set in, caused test manufacturers to back off on production, and we haven't quite got back on track yet. With OSHA's ETS imminent, it's likely that employers are going to have to use whichever of the two tests they can get, and probably a combination of the two, until production levels can meet that demand again. And one final note on types of tests. You've probably heard people refer to antibody tests, and this is not the same as the rapid antigen test. The antibody test tells you whether you have COVID antibodies in your system, which could be either from a vaccine or from a previous COVID infection. The antibody test does not tell you whether someone is currently infected with COVID-19. Both the EEOC and the CDC have said that antibody testing should not be used in employment settings for any reason. First, because they're not very accurate currently, and second, because it doesn't measure whether someone is currently infected and whether they're contagious. It's only measuring past infection. Now moving on to the logistics. Like vaccinations, we're going to look at timing, location, leave, and proof. For timing, you're going to want to consider when you're requiring your employees to be tested by. This is going to depend in part on which test the employees use. For the rapid test, you can just pick a day of the week. If you're doing weekly testing, of course, you can do more frequent testing, and have employees take the test and submit the results on that day before the employee goes to their workstation. For the PCR tests, you're going to need to allow some buffer time. For example, you might tell employees they need to submit a negative test result by Wednesday morning to cover the next 7 days, until the next Wednesday. Then you kind of let the employees decide when they're going to get tested as long as they have a result by that Wednesday. For location, you have 3 options. You can administer the test on-site, you can have employees go to a third-party testing site, or you can have employees take their own tests at home. First, the on-site tests, these help minimize disruption to the company's operations. They give you control over the samples and test results, and they minimize the administrative burden of paying employees for testing time because it's much easier to track when they're in the workplace. But there are additional costs for on-site testing. You're going to have to train and designate employees to oversee the tests. You'll have to set aside a place for testing, and you'll have to make sure that you have a constant stock of tests to cover employees who need them. Off-site testing has the benefit of cutting down on some of that overhead for administering the tests and puts a third party in control of the test samples and results. However, as we'll discuss in a moment, you'll likely need to compensate your employees for the time it takes them to get tested. And having them go off-site makes accurately recording that time more difficult. The availability of reliable off-site testing sites will also depend on your area. So if you're going the off-site route, it's best to provide employees with a list of testing sites in your area that they can use. Finally, there's also the option of at-home testing. There are now a number of home testing kits for the rapid antigen test that employees can administer themselves at home, get results in 15 to 30 minutes. Employees will still need to be compensated for the time it takes to take the test, but this is going to be significantly less than the time it would take them to get tested at, an off-site facility like a Walgreens. The obvious drawback here is that you need to rely on employees to properly administer the test and accurately report the results. And that means there's a lot more room for human error or even tampering than with the other 2 options. Finally, for proof, as John mentioned earlier, you can require a copy of any test results pending state law, either from a laboratory or a local testing clinic. There are now a number of products and services that help you track and store test results electronically, which will help cut down on the storage burden of paper test results. If you decide to allow at-home testing, a number of test kits have options for sharing test results, through a mobile app. So you might look into that and see how you can coordinate with some of these testing programs to collect results. As with vaccination records, test results should be treated as confidential medical information, and be kept separate from employees' general personnel files. And now I know this is the topic everyone's excited about. Who's going to pay for all of this? When you're talking about paying for testing, there are two separate issues. There's paying for the actual tests and paying for the time it takes employees to get tested. For that second piece, the DOL has issued guidance that says in almost every case, employers need to pay employees for the time it takes them to get tested. And that's if the testing is during working hours, that's if it's before or after an employee shift, and that's even if it's on the employee's day off. As John mentioned, states like California require you to pay for that time regardless of what the DOL says. But the bigger question is, who pays for the actual tests? The bottom line is that the cost is likely going to fall to the employer. California and several other states already require employers to pay for testing, and based on previous OSHA guidance and rules, it's likely that testing is going to be considered a safety cost that falls to the employer. The DOL has said that when it issues the OSHA ETS, it will address payment in there. So that's something that will be clarified. It is possible that the thought process behind making employers front the cost of testing is that it incentivizes employers to mandate vaccines and only allow for testing in the case of, religious or disability-related accommodations. The more of your employees who are vaccinated, the fewer tests you need to pay for. Now, there are a few ways for employers to try and reduce the cost burden. First, under the Families First Coronavirus Response Act released last year, COVID testing is still free for anyone who has a medically appropriate need. Now, routine workplace virus surveillance, requiring your employees to get tested weekly, is specifically exempted from coverage under the FFCRA. So you don't get free testing for that. However, if you have employees who think they've been exposed to COVID-19 or who have a reason to believe they might be positive for COVID-19, you can direct them to go get free testing under that law because now they have a medically appropriate need. They feel they've been exposed, they have a reason to believe that they're positive. Those are medically appropriate and qualify for free testing covered by insurance providers. Second, there are still a large number of free testing sites in states across the country. So it's worth looking in to see if there are any in your area. And if there are, you should give employees a list of them so they can use those sites rather than have you pay for testing somewhere else. It is very possible that these sites will close down or be harder to access after the ETS goes into effect, based on that increase in demand. But for now, this is one way to cut down on the cost of testing in some areas. And finally, the Biden administration has also said that they are working to lower the cost of testing in conjunction with the ETS. We don't know what that will look like yet, but there is a possibility that employers may be able to source more tests at cost, which could be a significant savings. Testing right now can run anywhere from $140 to $1,400. So we'll be monitoring to see how any cost reductions will come into play. And with that, we have some time to move into the question and answer portion of today's webinar.
Yeah, thank you, Colin.
Thanks, Colin.
I'm going to throw out a few questions for my colleague panelists. It's always better to ask the questions, which some of the attendees have asked. One would be, which comes up more than once, and I'll ask any Colin or John. Can you ask a potential employee whether or not they've been vaccinated? Can you ask them during the interview?
So you can ask applicants. So you can ask applicants whether they've been vaccinated. The EEOC has said that it is not a disability-related inquiry. However, it's likely best to do that, after you get to the conditional offer stage, so it doesn't look like, you're weeding out people who might have a medical reason not to get vaccinated. The kind of preferred method is to upfront tell applicants, here's the company's vaccination policy. We might have to comply with this federal mandate or this federal mandate. If you're given a conditional offer, you'll need to show proof of vaccination. And then, you go through the process with them. Once they've been given the offer, then you can require some sort of verification.
Okay. John, did you have anything to add on that?
No, I agree with Colin.
There was a question from an attendee earlier on about whether or not the Biden contracting order applies to contracts under $250,000. I can provide part of that, and I know John will as well, which is below $250,000 under the simplified acquisition threshold. That whether or not the mandates are applicable is at the discretion of the contracting officer. So you could have a contracting officer who's very gung-ho, who wants to push vaccine mandates and could impose that requirement on on that type of a contract. So it's totally discretionary, but it's certainly possible. Don't think you're out of the woods automatically just because you're under the $250,000 minimum threshold.
And I would add, Chuck, that it's expected that the threshold not only may be lowered, but there is an exception to this, and there's a question we've received. Does the exemption for federal contractors or subcontractors apply to contractors that only provide products? And the answer is that federal contractors or subcontractors with Walsh-Healy contract, in other words, manufacturing contracts or furnishing materials, supplies, or equipment to the government or the District of Columbia, are not covered by the new executive order with respect to federal contractors.
Okay. Is it a sincere religious belief if we receive an exemption letter that somebody took verbatim from a political activist website blog? I think that would probably give you a right to conduct a further limited inquiry as to what the basis is for this, and what the basis is for that belief, and how does that apply? Is it abortion-related belief, or is it somehow or another tied to medical or other philosophical reasons? And I think a bit of a discussion is something appropriate. You don't have to accept that at face value. I will tell you from general experience with litigating religious accommodation cases, the courts are generally fairly reluctant to get into questioning the sincerity of someone's belief, but clearly they certainly did question it when you had a bunch of prisoners get together who said it was their belief that they had to use their religious belief that they had to use marijuana and other unlawful drugs at the time, or controlled substances as part of their religious ceremony, as opposed to, for example, a Native American who said peyote was something that was a part of their religious practices. So to the extent they're inconsistent with kind of settled doctrines of the church or of an organized religion, that probably raises some questions about sincerity. But if there's some foundation in some religious or moral principles, then that is something that you might have to end up relying on ultimately. We had another question along those lines: if someone has taken, any number of vaccines, and all of a sudden this one they don't want to for religious reasons, then yes, I think that it's appropriate to conduct a further limited inquiry. You just can't, you can't argue with somebody about their religious beliefs, but you can, engage in a further limited inquiry in that regard. And along those lines as well, certainly, like I said, we would suggest that you require certification, require, some proof to support that as to where that's coming from, and not something they pulled off the internet. Have they consulted with a religious advisor about this? Who would that be? That sort of thing. I will tell you that sometimes we've had people who want to sign who we've asked to sign for a client a certification form, and the employee said, well, I can't get anybody to sign that form because I take my message from God, and God isn't around right now to sign it for me. So I think on that, unless anybody else on our panel have any other questions they want to address briefly in the time we have remaining, which is very limited.
Let me just, Chuck, address quickly a question we got about whether or not fully vaccinated means getting a booster shot. At this time, the answer to that is no, because other than for Pfizer, booster shots have not been FDA approved yet. However, I think we can expect to see down the road, as they're called booster shots, but they're actually just third shots, and perhaps, as Dr. Fauci's indicated, even fourth or perhaps additional shots may be needed. I think we can expect to see OSHA amend its rules on the definition of fully vaccinated. Last but not least, we're getting questions about what if I'm in a state such as California and the mandates require testing if you have less than 100 employees. I think the answer to this question, whether you're in California or in another state or locality with stricter mandates, is that you should follow the stricter mandate, the one that requires testing. For instance, with the Family First Coronavirus Act, California and San Francisco and Los Angeles had their own versions of the act in which the big box exemption, because the federal act only applied to employers with 500 or more, was taken out. So it applied to all employers. So I think you need to apply to any jurisdiction which has a stronger mandate than the federal mandate.
Colin, anything else you want to address?
No, I think that's good. We will get to any questions that we didn't have time to answer in the Q&A, and we will respond to those by email.
Yes. So again, thank you. That's all the time we have for today. We really appreciate you attending. We really like the fact we had questions. We wish we could be all in some type of virtual or physical room where we could answer all those questions, because I know everybody's got a lot of questions, and feel free to follow up with any of us on questions. We also hope you will attend our next session on October 27th. It won't be with our panel, but a different panel on remote work issues. And frankly, if the OSHA regulations come out in between, which looks likely, you would expect that we probably would try to address those as well if possible. And we will certainly do an updated invitation if that is the case. So stay posted. You can find our entire calendar on Thompson Coburn website. So certainly we appreciate your participation in the course. Please complete and submit the survey that will be displayed at the end of the webinar. And thank you all again for attending.